Thank you.
Thank you, Deputy.
Well, Cathaoirleach, this bill makes several changes to the law on risk equalisation between insurance companies to regulate the operation of the health insurance market. Now, the main one is to increase the health insurance levy on health insurance premiums by 10% from April next year. Minister, I understand that you wrote to the insurance companies pleading with them not to pass on this increase to their customers. You didn't write. OK, you made an appeal over the airwaves? You made an appeal over the airwaves asking them not to pass on the increase to their customers. I would say the executives of the health insurance companies probably cracked up laughing when they heard that appeal, because with your government refusing to introduce price freezes and refusing to ban them from passing on the increase, it is certain sure that the insurance companies in turn will hike insurance premiums next year. Penny for penny and pound for pound, as they used to say, this will mean insurance policy hikes of between €20 and €41 per adult and €7 and €14 per child. Health insurance price hikes are now more or less percentage-wise equal to increases in the rate of rent. Rents rose 11% on average last year. Health insurance premiums are in the same general field. This comes on top of health insurance price hikes of an average 63% in the period 2008 to 2015. Now, I noted the comments of the leader of Fianna Fáil, Micheál Martin, the other day, where he supported wage restraint and argued instead for bringing down living costs as a way of assisting hard-pressed working families. But now, just days after those comments were made, we have Fianna Fáil spokespersons indicating support for a bill which will mean a 10% hike in health insurance costs next year. I think this is glaring hypocrisy. In reality, these impending health insurance price hikes show the need for pay increases for all workers. Trade union action on behalf of working people, both in the public and private sector, is fully justifiable given the pay cuts of recent times and the sharply rising cost of rent, car insurance and, as we're debating tonight, health insurance and so on. This bill also underlines the urgent need to establish an Irish National Health Service to provide universal health care, free at the point of use and funded from general taxation. Such an Irish National Health Service would represent a sharp break with the current health service model, which increasingly is based on and relies on the for-profit element. Such an Irish National Health Service should also draw from the Canadian model and the Canadian experience, where private practice in most areas is illegal, thereby doing away with the need for private health insurance. I understand, Cathaoirleach, that health expert Professor Charles Normand has estimated that the cost of replacing health care covered by private health insurance with public spending would be between 5 and 7% of total health spending, or 7 to 10% of current public health spending. This gap could be closed and the basket of services could be widened well beyond the level of service currently covered by health insurance premiums if we were to introduce a genuinely progressive tax system which made the super wealthy in this society pay tax bills which correspond with reality. Despite the fact that 46% of the population had private health insurance at year's end 2015, private health insurance contributes a mere 9% to the overall cost of healthcare, whereas the state pays a whopping 77%. As the health expert Sarah Burke said recently, this shows that the public system is subsidising the private system. It also shows Cathaoirleach how inefficient reliance on the private health insurance model actually is, and gives an idea of the level of profit gouging being carried out by the insurance corporations. Cathaoirleach, in conclusion, the case for an Irish National Health Service is clear, it is overwhelming, and the scandal of health insurance profiteering merely further underlines the merit of the case. Thank you.
Thank you, Deputy.